Hi there, and thank you for tuning in to crisiscompetence.com with me, Ulf Lidman. I have talked a lot about anxiety in my blogs during this pandemic, and that's because a lot of people have contacted me that are suffering from anxiety as a result of corona, but also as a result of other things that they are going through in their lives. Some people that have contacted me have been concerned because they have gone to the doctor and they have been prescribed medication for their anxiety that has an active substance in it that is called benzodiazepine. Benzodiazepine is a very addictive narcotic that are in many pills that doctors prescribe. This substance is highly addictive, and it's also a substance that if people who are on it decide that they're going to get off benzo and they do it by themselves, cold turkey, and just stop taking their pills, then there are many cases where that has led to suicidal thoughts or even to psychosis. Just during this pandemic, I have had several people that have contacted me that decided that they were going to get off their meds, and instead of going to a qualified psychiatrist and get help in getting weaned off the benzo, they did it by themselves. And unfortunately, it led to both suicide attempts and to psychosis in a couple of people. Why I'm bringing this up is because, unfortunately, there are many unqualified doctors that are pill mills. Doctors that will prescribe pills and they won't even go through with the patient what the side effects are of what they are prescribing. And I think that that is very serious. So please, if you think that you need medical help with anxiety, please don't go and see just any general doctor. Go and see a psychiatrist who has the qualifications, who knows what can be prescribed. There are some great alternatives to benzo that are not classified as narcotics. Why I'm saying this is because in the past 2 decades, I have had so many clients that are hooked on benzo. They are drug addicts, and the drug dealer has been doctors that have prescribing it to them without really informing them what it is that they are taking. Please, anxiety can be helped with medication that is not benzodiazepines. If you are on benzo, I would encourage you to go and see a psychiatrist and discuss how you can get weaned off this drug. It should be done very slowly and under the supervision of a doctor. And that doctor will also have the qualifications to discuss with you if there are any other alternatives to what the treatment that you are currently on. The reason I'm saying this is because I have spoken a lot about anxiety, and that usually brings up the topic of benzo. I am not a favorite of benzo, but I am not a medical doctor either, so therefore I want to be humble in what I say. But at the same time, having worked with benzo addicts for 2 decades is also making me realize that there are a lot of people out there chewing these pills that should not be doing so. But again, anything that has to do with drugs, consult a qualified psychiatrist. Have a brilliant day.